Please could you tell us about active and passive exposure to drugs?
So one of the things I'm looking for when analysing hair and nail samples is that you can incorporate drugs through active use, so actually taking the drugs themselves, but you can also incorporate substances passively. This is called external contamination, where drugs exist in the environment. So you may have heard that banknotes are known to contain a very, very trace amounts of cocaine. So regular touching of banknotes could cause some very, very small levels of cocaine to build up in, for example, your nails from your fingertips. This is a very important consideration in a legal context because we want to look for active use of the drugs and we want to separate this from any potential passive exposure to these drugs. There are many different ways that someone can be passively exposed to drugs. These include regular contact with other people that are active users of these drugs, so hugging, kissing, tussling their hair, or sharing a bed with someone. You could potentially have these tiny amounts of drugs transferred over into your hair and nail samples. The two main processes that we go through in the laboratory to prevent passive exposure from causing positive results is, on the analysis side of things, we wash any hair samples with solvents to remove this external contamination from interfering. And on the interpretation side of things, we adhere to strict guidelines, reporting guidelines, that are designed to differentiate between the very low levels of external contamination and what we would consider active use by the individual. So external contamination is more of a problem when we're looking at children's hair cases because their highly porous nature of their hair means that drugs can be absorbed more readily into the hair structure if they are exposed to this external contamination. That's why at AttoLife we test for both the hair sample of child cases, but we also routinely test the washers looking for any signs of external contamination, as this gives us a full picture of the child's environment and what they may have been exposed to.